Good morning, everyone. Myself Bharat. Here I am presenting a role of Marma Chikitsa in management of Avbahuk with respect to frozen shoulder. My guide are Dr. Reacha Deo ma'am and Dr. Ashwini NarNavre ma'am. Here are 107 total marmas are mentioned in our Sanhitas. As Acharya mentions, Mara Ititi Marmani, and it is a meeting point between Mansa Sirasnai Asti Sandhi where Pran is located. Here is some classification of marma. Total 107 marmas are there. Upper and lower limb contains 44. The back region contains 14 marma. The chest and abdomen contains 12, and Urdhva Jatrugat contains 37 marma. This is the basic classification of it. Materials and methods. Data was gathered from ancient science texts, Ayurvedic practices, physicians and surgeons, internet, as well as personal experience. Aims. The cardinal point to management the pain in should be holistic, patient-centered in and its application. This can be fulfilled in the Ayurvedic approach only in terms of Marma Chikitsa. Objective to study the Avbahuk with respect to frozen shoulder. In modern science, the Avbahuk can be correlated with frozen shoulder or adhesive capsulitis. It is a condition characterized by stiffness and pain in shoulder joint. Range of motion exercises, sometimes corticosteroids and numbing medications injected into the joint capsule. NSAIDs, arthroscopic surgery indicated. In Ayurveda, frozen shoulder can be correlated with Avbahuk. This is the case we have seen it at Diksha Bhumi Medical Camp, a 45-year female patient. Pain in the shoulder, complaint of pain in the shoulder region, movement of head, decrease the range of shoulder motion as well as joint stiffness. Here we have done Marma Chikitsa in his treatment. On the basis of clinical experience, patient was diagnosed and case of Avbahuk. Here we have performed the Ansa Marma, which is one finger breathe downwards from the elbow crease, both on the medial as well as the lateral aspect. It is a Snayu and Vaikallikar Marma, size of half angule. Here I am presenting the second Marma point is Ansafala Karpur again. It is one anguli, one finger breathe downwards at the elbow. Here is a Shipra Marma as well as we have performed the Marma treatment. Ital Hriday Marma pressing. These are some indications of Marma Chikitsa. It can be useful in musculoskeletal disorders, alimentary tract diseases, respiratory tract disease, cardiovascular disease, neurological disease, genitourinary tract disease, metabolic disorders, eye and ear related disorders, cerebral palsy, Down syndrome, mental. There are optimal time between contact time is 0.8 second, and it should be repeatedly after 12 to 20 times. The following are the general rules followed by the administrative Marma treatment. Fingernails should be cut in both the hands, and Marma points in the body should not be touched by the fingernails. Make the patient to sit or lie down during the procedure. It is sufficient to cure the disease by rendering Marma treatment twice in a week, but depending on the chronicity of the disease, it should be vary. Mode of action of Marma: it removes the energy channels, blocks in the your energy channels, specifies doshas, bringing the normal path, relaxes the stiffness of the particular area, and gives flexibility to the muscles. Removes one type of avaran of scar tissues developed in the shoulder region. That is why patient got symptomatic relief. Create and be used in therapeutic and preventive aspect of health. Concludes here. I am concluding it is a promising, fast acting, cost effective, less time consuming, easy to use and non invasive alternative method of treatment of Avbahuk. Here are